Well, good afternoon, everyone, and welcome to the Intermountain Healthcare Nevada Medicare 101 presentation. My name is Neil Finn, and I'm the Manager of Broker and Community Relations here at Intermountain Healthcare, formerly Healthcare Partners Nevada. Our team typically hosts and attends in-person events to connect with our Southern Nevada community and share the exciting things we're doing as an organization to care for our patients. Although we're not currently able to connect with you in person, we're thrilled to have launched virtual events to connect with you from the comfort of your own home. We understand that enrolling in Medicare is a very important decision, and we appreciate you joining us today to learn Medicare options. We're joined today by Greg Barson, and he's a licensed insurance agent with Simple Senior Benefits. Before I turn it over to Greg, I'd like to share a little bit more information about Intermountain Healthcare. Next slide, please. Intermountain Healthcare is a well-respected regional health system and of caregivers who serve the needs of people across Intermountain West with facilities from Utah to Idaho and now Southern Nevada. Additionally, we provide telehealth services and partnership agreements across a much broader area of the Western United States. Intermountain Healthcare has been recognized by national leaders as being among the top 5 health systems in the country, and it's considered a model health system for providing high-quality care. Both Healthcare Partners Nevada and Intermountain Healthcare align in our missions and values of helping people live the healthiest lives possible in Southern Nevada. If you're an existing patient and you will still receive the same high-quality health care from the providers and care teams you have known to come at the same locations. The strengths of Healthcare Partners Nevada are combined with the expertise of Intermountain Healthcare to create a stronger, more comprehensive regional healthcare system. Next slide, please. We're incredibly proud of our provider network and the high-quality healthcare services we offer our Southern Nevada community. We have nearly 300 primary care providers and more than 100 primary care locations. We're excited to share a bit about our My Generation senior clinics on the next slide. Currently, we have 30 senior-focused clinics in Southern Nevada this year. Our provider network also includes access to over 1,500 specialists, 25 urgent care and walk-in locations, and 20 hospitals, plus virtual visits with your care team. Next slide, please. Our My Generation senior clinics feature concierge-style primary care designed specifically for our Medicare Advantage patients. This unique clinic concept has a lot of extra care team support, plus amazing access standards to help our patients get care when and where they need it. You'll have access to a dedicated referral team, on-site care management, and navigator support, plus some locations have an on-site lab. New patients in 2 weeks, while established patients will be seen within 2 days when medically necessary. We also offer same-day appointments for urgent needs. We limit the panel size of each provider to 750 patients, so each patient can spend more time with their provider. In fact, our average appointment time is 30 minutes, which is twice as long as the industry standard. As mentioned earlier, we offer virtual visits to help our patients stay safe and healthy at home while still accessing care. Next slide, please. Here's a map of our My Generation senior clinics. We currently have 30 locations. We have over 100 senior-focused providers at these 30 locations. 5 of our clinics are Humana-affiliated practices, so only Humana Medicare Advantage members can access care at those locations. But the remaining 25 accept both Humana, United Healthcare, and soon Select Health Advantage members. If you'd like to become a My Generation patient, simply call a clinic near you and we'll get your first appointment scheduled today. Next slide, please. So just to remind everyone, in the bottom corner, you'll see a chat feature. If you have any questions during the presentation, please go ahead and write those questions in the chat feature and we will address those at the end. So with that, I will hand it over from Greg Barson at Simple Senior Benefits to take it from here. Greg?
Thank you, Neil. Intermountain Healthcare has been doing a great job in our local community for seniors accessing care, so I appreciate them allowing me to come on and share a little bit about what Medicare is And I think that one thing that we can all agree on is Medicare can be very confusing. So I'm going to kind of go through some of the nuts and bolts and try to explain what Medicare is and what your options are. So whether you're brand new to Medicare, turning 65, or have been on Medicare a while, maybe still working and coming off of a group plan, I'm here to explain how all your benefits work and what your options are so you can make the best decision of what type of plan option is going to work best for you. So with that, I'm going to kind of go through and talk about a little bit about the time, who's eligible for Medicare. So right now we know it's, I'm going to go into open enrollment here in a minute, but, right now is kind of a busy time. You probably see a lot of commercials going on for Medicare, a lot of mail, but anybody over 65 or anybody under 65 that's been on Social Security disability for at least 2 years qualifies for what the government calls original Medicare. And there's two parts to that, Part A and Part B. You also have to be a U.S. citizen or a legal resident living in the United States for at least 5 consecutive years to qualify for Medicare. Okay? And so there's a lot of everybody's situation is slightly different, but those are the premise to whether you may or may not be eligible for Medicare when you turn 65. When you turn 65, you get an initial enrollment period to enroll in a plan and to enroll in Medicare and choose a plan option that's going to work best for you. And during that time, there's actually a 7-month window that you have to choose the plan. You get 3 months before your birthday, the month of your 65th birthday, and even up to 3 additional months to transition into Medicare. So they give you a 7-month window. Outside of that 7-month window, you may or may not be able to enroll. You have to enroll in Medicare only at certain times of the year, and you may face penalties if you don't have the proper coverage. But if you're still working at 65, you can elect to stay on your employer-sponsored plan, or you can look at Medicare and what a plan would be through Medicare to see which one is going to be the best for you. Okay? So right now we're in what we call the annual enrollment period, or AEP. This is a 7-week period where everybody who's on Medicare or new to Medicare can evaluate all their options and make any plan changes that they want. Any plan change made during AEP will begin on January 1st. So even if you change today, the new plan will start January 1st of 2021. We also have an enrollment period going from January 1st to March 31st where you are allowed one more change. So if you're in a position where you're wanting to try a new option and see if something might work better for you, you have the luxury of using that plan for up to 3 months and deciding on whether you want to go back maybe the plan that you had or even a completely different option during that 3-month period. Outside of AEP and the open enrollment period from January to March, you have to qualify to be able to change your plan throughout the year if something comes up. But there's a lot of reasons why people may qualify for what we call a special enrollment period. And that's anybody getting any low-income assistance through the government to help with medications or Part B premiums and those kind of things, or anybody who may have recently changed addresses. If you change and move from one county to another, that gives you a special enrollment period to make a plan change as well. And there's a lot of other reasons why you could change plans throughout the year or enroll in a new plan. And maybe it's you're retiring now and coming off of a group plan, you qualify for a special enrollment period as well. So original Medicare is what the government provides. And there, like I said, there's 2 parts, Part A and Part B. Part A is your hospital coverage. Part B is your medical coverage. And you get a red, white, and blue card that looks like this. It's a paper card that the government sends out. And this is your original Medicare card. If anybody on the call has been on Medicare before, they know that they used to use the Social Security number as your Medicare number. So in 2018, they signed legislation to change that. So everybody got a new card that looks like this one here on the screen on the bottom right. And this is what the new Medicare card looks like. And it's a completely random ID number now so that you don't run the risk of identity problems and stuff if somebody gets a hold of your Medicare card and has access to that Social Security number. So that was a good thing that it took. It actually took an act of Congress to finally make that happen. So that's a good thing. So let me go through and explain kind of what Medicare is. So your Part A is your hospital coverage, like I mentioned. But it also covers a lot more than just hospital stays. It covers skilled nursing facility. So if you go in the hospital after and for a surgery or after an accident and you have to go to a nursing facility to do rehab or finish recovering, that's covered under Part A of Medicare as well. And then also home health care. So if you need a nurse to come out to continue therapy visits or rehab or change bandages and things like that, that's also covered under Part A, as well as one other thing, and that's hospice care. So those are the four items that's covered under Part A of Medicare. And typically, most people don't pay anything to be on Part A of Medicare because they worked or had a spouse that worked the 40 required quarters to be eligible to get Part A for no premium. If you or your spouse did not work at least 40 quarters or 10 years equivalent of paying into Social Security, you can still maybe get Part A, but you may have to pay a premium for it. So just want to make you aware of that, but most people get it for no premium. But even though it's no premium, there are out-of-pocket expenses. So this goes all the way back. This is kind of a chart that shows you how Medicare costs have changed over the years. And I like to show this because probably everybody on the call was born when Medicare first started, which is in 1966. And back in 1966, the Part A deductible, so if you went into the hospital, you paid a deductible for that hospital stay, and it was $40. And that deductible goes up a little bit every year. And now in 2021, if you go in the hospital, you're going to pay a $1,484 deductible on original Medicare. Okay? And don't be alarmed by these figures because the plans that we have through the Intermountain Healthcare Network are going to wipe a lot of these copays out. So you don't need to worry. This is just the program that's offered by Original Medicare. So if you only get that red, white, and blue card and don't elect any other type of coverage, which I'll go through your options, just to educate you, then this would be your risk out of pocket. You could pay that $1,400 deductible up to 5 times per year. So every 60 days it resets. So if you go in the hospital, and even if you were in there for 1 day or even up to 60 days, you're covered under that one deductible. But if you're released for 60 days or more and you go back, you could pay that deductible again. And then if you end up staying more than 60 days in the hospital, then you start paying a copay per day up to day 150, and as you can see here. So it can be quite expensive if you don't have some type of supplementary coverage to help with these out-of-pocket expenses. Medicare is kind of like an old 80-20 plan with deductibles, so you got to make sure that you have a program to help offset those costs, and I'll go through that here in a minute. But Medicare Part B works a little differently than Part A. This is all your medical or outpatient services. So when you go see the doctor, it's covered under Part B. When you have an outpatient surgery, it's covered under Part B. Even if you go to the ER, that's not an inpatient. So ER is outpatient, so that's covered under Part B of Medicare. And as well as ambulance rides, or even if you go get your lab drawn or have an MRI or a CAT scan, those are all Part B services. The standard monthly premium for Part B is $148.50 for next year. They just released those figures a couple days ago. So if you remember, this year the Part B premium was $144.60, and it's going up about $4 for next year, which is good. They were anticipating it going up to about $153, but I think they gave a little bit of a break due to the COVID and things that we've been dealing with this year. So that's good for anybody who's on Medicare, that the premium's only going up a couple dollars next year. However, some of you on the call may be just retiring this year, or recently retired, or maybe you're still working and you're going to be retiring in the future. The Part B premium is based on your income. So if you look at this chart, you'll see what your potential income could be for next year. And so if you make $88,000 a year or less, you pay that standard premium of $148.50. But this is based on a 2-year look back. So you're paying the premium for next year based on what you made in 2019. So it's not based on what you made this year is what you pay next year. It's actually another year back. So what your adjusted gross income was in 2019 is going to indicate what your premium is for 2021. Okay, so as you can see, if you're a higher income earner, your premium could go up. As the highest premium is $504.90 for next year. And however, if you had high income and now you have a very limited income, and it's a drastic change from when you were working, we can help you appeal that so that those numbers come down much quicker than having to pay high premiums for 2 years when you're not making that type of income. So just be aware of that we're able to assist with those type of services. So Part B, the deductible for Part B is an annual deductible. So you only pay it one time per year, and then you pay your 20% the rest of the year for any covered services. So the Part B deductible for next year is $203. So this is completely separate from your hospital costs out of pocket. This is anytime you go have any of those Part B services, so doctor visits, surgeries, labs, or MRIs, those kind of things. You pay the first $203, and then you pay 20% after that. Okay, so of the bill, there's over 1 billion claims submitted to Medicare every year, and 99.3% of doctors accepted what Medicare's charges were. So there's very few physicians out there that don't take original Medicare, because if they don't take original Medicare, you could be charged a little bit more than that 20%. But working with the Intermountain Healthcare Network, you're not going to have to worry about those types of extra costs for sure. All right. So in a nutshell here, your Medicare options are as follows. So once you enroll in both Part A and Part B, that's what the government provides. And, I know that this is a Medicare 101, so I'm sure that there's a couple of people who are maybe new to Medicare or going on Medicare soon. Medicare, one of the services that we provide is helping you get enrolled in Medicare, whether it's brand new at turning 65, or maybe you elected not to enroll in Medicare A or B because you were still working and now you're retiring or coming off your group coverage. there's specific forms that you have to submit to Social Security to get that Part B activated. And so we help with those forms and how to get that submitted ASAP so your coverage can get processed and you can get your Medicare enforced. So after you get both Part A and Part B, then you get to decide whether you want to go with option 1 or option 2. Option 1 is what we call the Medicare supplement. And that insurance, or another word for Medicare supplement, is Medigap. That's secondary insurance to Medicare that picks up most or all of those out-of-pocket expenses that we just went through. Those $1,400 deductible for the hospital, the 20% on the medical. So there's supplementary coverage that you can buy that pays those out-of-pocket expenses. And then you need to get a separate Part D prescription drug plan. So drugs are a big deal. So one of the benefits to working with an advisor like myself is we have access to all the major companies, and we can put all your prescriptions into the system and compare the drug plans to make sure you're saving the most money possible on your prescriptions. Because there can be huge fluctuations from one plan to another just with a few medications. Okay, mostly a lot of the plans are pretty good about covering generics, but if you have some higher expensive medications, you for sure want to do a cost comparison to make sure you're not paying anything more than you need to. The other option, which is probably by far the most, the option that most people go with here in Clark County is option 2, and that's what we call the Medicare Advantage plan, or Part C of Medicare. That's where they combine your Part A, your Part B, and your Part D all in one plan, and those type of plans give you some extra benefits and services. So we'll go through that here briefly, a little bit more in depth. So whether you want the supplement to have a little bit more choice and flexibility, or option 2, working in a network of doctors and hospitals like Intermountain Healthcare for your care, you know, you get to decide on what proposition is going to work best for you. So with the supplements, you know, there's a lot of different supplements, as you can see here from this chart. There's A, B, D, G, K, L, M, N. Plan C and Plan F have gone away for anybody new to Medicare this year. So Plan G is the next best plan that covers most services out of pocket after Medicare covers their services. But obviously it's going to be the highest premium out of pocket. So you're looking at around $150 a month for turning 65 on a Plan G, somewhere in that range, depending on the carrier and the company. But it will pick up most of all of your out-of-pocket expenses. And then you would need to still get that Part D drug plan. And like I said, we do it, you know, there's so many variables involved with the drug coverage that we just do a cost analysis to make sure that you're getting the best savings and going to, you know, and sometimes that's maybe going to mail order or getting the 90-day supply, or maybe, and once in a while, it's changing pharmacies to get a better deal. So we look at all those type of things, which, you know, a lot of times it's hard to find that information if you're just searching for it yourself. And that's one of the benefits that we have is doing this for so long. We kind of know the tricks of what plan works better with certain pharmacies and certain drugs, especially costs like insulin and some of the expensive costs. There's new programs available to help with those expensive medications throughout the year. So Part D as well is based on your income. So the chart is going to look very similar to that Part B chart. So you have to pay, if your income is higher, you may be charged a higher premium, you know, than you thought. If the plan was a $20 or $30 a month plan, if your income was higher 2 years ago, you could be charged what we call an IRMA adjustment, an income-related monthly adjustment based on your income. But if your income has substantially changed over the last year, we can apply to get those type of things off. So just wanted to make you aware of that. Medicare drug plan. So the drug benefit, all of the companies that offer drug coverage follow the same chart, okay? So here we start at the bottom with stage 1. And if a plan has a deductible, you pay the full retail price until you've met that deductible. After you've met that deductible, or if there is one, then you move into stage 2, which is what we call the initial coverage stage. This is where you pay just a copay for your prescriptions. You know, like generic copays can be anywhere from $0 to $10 a month. Brand name are somewhere in the $30 to $50 range. So it depends on your particular medications, what tier fall into, okay? If your drug costs reach a certain threshold, which is what over $4,000 a year out of pocket to the total drug cost, then you can reach the coverage gap period, or also known as the donut hole. Not a lot of people reach this, but there is a gap period where instead of paying a regular copay for your prescriptions, now you're going to start paying 25%. So we will make sure that you understand if this is going to be an issue and you get to that, what plan is going to cover those drugs the best when you get to the gap. All right. So the Medicare Advantage plan, which is, these are HMO and PPO type of plans. A lot of times it's very similar to a plan that you had while you were working, where you just show one card for all of your services. Whether you go to the doctor, the hospital, pharmacy, you just show your plan card. And this has your hospital, your medical, your drugs, and a lot of extra benefits all included in the plan. So to be eligible for an Advantage plan, you have to, there's 2 qualifications now. There used to be 3, but now there's only 2. You have to be on Part A and Part B of Medicare, and you have to live in the plan service area. So every county in the country has a different plan. So the plans here in Clark and Nye County, these are the, you know, if you live in Clark County, you can only enroll in a plan based in Clark County. That's why if you move to another county, you'll have an opportunity to change to a plan in that area. You'll never want to move from here, because the benefits here are as good, if not better, than almost anywhere else in the country. Because I'm actually licensed in 42 states. And so I've seen plans all across the country, and there's no other plan quite as good as Clark County, Nevada. So you guys are lucky to have what I would consider to be the best Advantage plans in the country. Very competitive market here, senior friendly, and with that comes a lot of benefits. And I can't get into plan specifics on copays and stuff, but they're very low with most of the carriers that we have here. There used to be a question about if you were on kidney failure or kidney dialysis, you were not eligible for a Medicare plan, but starting in 2021, anybody on kidney dialysis can choose any Medicare Advantage plan. So they got rid of that qualification entirely. So that is great news for anybody in that situation. The reason why the benefits are, the plans here are so good, the Advantage plans, is because you get to work within a great network like Intermountain Healthcare, but also the specific plans throw in a lot of extra benefits that makes it a great value for you. So Medicare only covers hospital and medical, and then the drugs. They don't cover any of this other stuff like dental or vision or hearing aids or transportation or chiropractic. A lot of the plans that we have here, gives all of these additional benefits, or most of them. So that adds a lot of value to where the Advantage plan is no additional premium. So most of the plans are no additional premium, and you're getting a lot of these freebies. So that is a great news. Some are better than others, but that's why it's good to do a plan comparison to make sure you're getting the best coverage for yourself. So that's kind of Medicare in a nutshell. So based on what you're looking for, if the most important thing to you is choice and flexibility, and you want to choose all your own doctors and be responsible for going to certain doctors, then option one can be very good, but you're paying a lot of money out of pocket up front to be on option one. Whereas utilizing a network of doctors like Intermountain Healthcare for your care, you can save a lot of money and get a lot of extra benefits by going with the Medicare Advantage plan through one of the companies that they work with. So we represent all of those companies, so we can do an analysis for you, go through all the plan benefits, and show you which ones are good for different situations, because everybody's situation is different. What might be best for your neighbor down the street is not necessarily what's best for you, because you're going to hear everybody in the, associate with might have one particular plan that they like or is good for their situation because of the drugs and the doctors that they see, just as your situation is going to be unique. The doctors you want to see, the drugs you take, the extra benefits that you want. So we make sure that you're getting the best possible program for you. So with that, we're going to open it up to questions. If you do have any particular questions or want to do a free analysis after this call, you can call or email me anytime and set an appointment, and I'm happy to just do a phone call or a Zoom call and do it over the computer, or we can get together at my office, or I can come to your home and sit down across the table and keep our distance. Obviously, I respect everybody's health and well-being, and I will wear a mask. So we want you to get the information. We want you to make sure that you understand what you're getting and that it's going to work best for you. So with that, we're going to open it up to questions now. So Neil, has anybody put any questions in the chat?
Thanks, Greg. Great presentation. A lot of great information. I don't show any questions yet in the chat. As a reminder, if you have any questions, feel free to go ahead and type them into the chat, and we can go address those questions now. So we'll give a moment or two and see if anyone has any additional questions.
Yeah, there's got to be some. Don't hesitate to just type in a question, or if you want to connect offline, we're happy to take a call and go through your particular situation.
Hey, Neil, there is.
Yeah, go ahead.
There is a question on here. I'm trying to pull it up. Can you explain the difference between Medicare Advantage and Medigap? Can we switch between those plans during open enrollment?
So the difference, okay. So if you're going, so when you go on Medicare, you generally would need to choose either one or the other. Okay. During open enrollment, you can switch between one or the other. Let me give you a scenario to kind of make it clear, because there's a lot of people that are maybe on a Medigap plan because that's what they chose when they first went on to Medicare. And I just had a call this morning actually from one of my clients that 5 years ago he wanted the Medigap plan, but now, and he actually goes to Intermountain Healthcare, so that was a good deal. But the premium on the Medigap plan is generally going to go up every year. So although it provides a lot of choice and flexibility, it comes with additional costs. So, but let me explain. So when you go on the Medigap plan, and maybe you come to a point where I've heard all about these Medicare Advantage plans. Yes, during open enrollment, you can switch to an Advantage plan, okay? But you actually get a full year to decide if you want to go back to your Medigap plan guarantee issue, okay? So you get a full year anytime during the year. If you're not happy with the Advantage plan, you can go back to your Medicare supplement. okay, and vice versa. So if you will go on a supplement and you're not happy, and because of the expense or whatever, you have a year to go to an Advantage plan. So there are loopholes in allowing you to go back and forth. If you go from a supplement to an Advantage plan, and then you like the Advantage plan, after the year, if you wanted to then go back to the supplement, you may have to go through underwriting and answer some simple Medicare healthcare questions. So it's not guarantee issue on the Medicare supplement. Medicare Advantage plans have to accept everybody with no issue. Pre-existing conditions are always covered, but Medicare supplements don't always have to accept everybody if you're not guarantee issue for one reason or another. So everybody's situation is different. So hopefully that answered a little bit of the question, but yes, if you, during any annual enrollment period, you can try to apply for the other plan. Always you're going to be accepted by the Advantage plan, but you just have to make sure that the supplement that you can go through the medical underwriting potentially if there is some.
Great, thanks, Greg. I have an additional question here as well. The question is, are there Advantage plans that cover outside of Clark County or Nevada or around the Western U.S.?
So, like I said, the Advantage plans, there's both HMO and PPO plans. So HMO plans are going to work within the network of doctors and hospitals that we have here in Clark and Nye County. If you go outside of this service area, you're covered only for urgent care and emergencies anywhere that you're traveling to in the whole United States. And a lot of the companies offer international coverage as well. So you're covered anywhere for if you get sick or have an accident, you're covered the same anywhere in the country as you would be here. You just can't say, hey, I want to go see a doctor in, California or Texas just to go, get a second opinion. If you wanted to go with a PPO would give you that flexibility that you have access to a nationwide network. But again, the difference between an HMO and a PPO in terms of out-of-pocket expense is going to be higher. The HMO, you get the most value, but we still have some very good PPOs from all the major carriers that will give you nationwide access to and be able to go to see any doctor that's in their network nationally. So there are both of those options available. If you're looking for the most savings, that's going to be the HMO. The PPOs gives more flexibility, but there's going to be a little bit higher copays than the HMO to have that more flexibility.
Great, thank you, Greg. And we'll continue to wait here to see if we see any additional questions as well.
Yeah, one of the things I didn't cover was assistance programs. So a lot of people qualify for some different assistance through the state and through Social Security to help with drug costs and things like that if they're on a fixed income. So those are great services that can definitely help people out, especially those that don't have a lot of discretionary income, cover some of their expenses. So we will definitely take a look to see what you're eligible for to make sure you're getting all the savings you can possibly get.
Great, thank you, Greg. We'll just give another moment longer. Again, if you have any questions, feel free to enter them in the chat, and we'll have Greg answer that. So it doesn't appear I see any additional questions, Greg. But for those folks who are attending, if you're like me, you always think of the question after the fact. So you do have Greg's information there. So certainly go ahead and contact him with any additional questions. Any additional parting Anything else for you, Greg, like to say before we sign off?
No, appreciate everybody being on the call today and listen to me try to explain something that's quite complicated. But, you know, one of the things is when you see the benefits firsthand with your, you know, your particular situation, it's a lot more clear at that point. So don't hesitate to reach out if you have any questions or concerns or just want to do a quick call to talk about doctors or prescriptions or plans. You know, I'm available almost any time, so just give me a call. Look forward to talking to somebody.
Great. And with that, I'd like to thank everyone for joining us today, and we hope to continue to stay safe, and we look forward to seeing you at a future event. Thank you, everyone.
Thank you.